I'm Dr. Angela Gabella. I'm a clinical neurologist and I own Precision Brain Center in Raleigh, North Carolina. My practice specializes in treating neurological disorders such as concussion, traumatic brain injury, neurodegenerative disorders, mood disorders, headaches and migraines, dizziness, dysautonomia, and neurodevelopmental disorders. Clinical neurology basically translates the most recent research into clinical practice to provide patients with evidence-based diagnostics and treatment. The patients that come to Precision Brain Center are patients that are looking for neurological rehabilitation. So whether they've had an ablative lesion or just physiological, they want their symptoms to resolve. So that's what we do here. We localize specific areas in the brain that have deficits, and we do targeted treatments to remap those areas in the brain. So it's a neurological rehabilitation treatment. As a clinical neurologist, it is my job to determine the root cause of a patient's symptoms. So during a neurological examination, you will find neurological deficits, which you can measure and then quantify, and you then compare it to the research. And you can get a very accurate picture of what's happening within that patient's nervous system. It's really important to find the root cause, even when it comes, we know that it's a neurological disorder, so it's coming from the brain, but there's a million areas of the brain. I mean, the brain is highly complex, and it's important to localize exactly where, treat it, and then all of a sudden symptoms go away. Everybody knows that nutrition is important for the body. I mean, if you live in the medical world, you know it is. I am particularly not a physician that prescribes a bunch of supplements, and the reason being is the way it works with the brain is that whether it's a medication or it's a supplement, when you take something, you can't selectively bind to a specific area in the brain. So globally, it's going to have an effect, and it's going to have a different effect on all the receptors that it'll bind to. So I'm not big on supplementation. However, Hardy's Daily Essential Nutrients have such a massive impact on brain health that it is, I mean, you notice when you come into the practice, it's the only supplement we have for sale in here because the research on it is incredible, but also you feel the results. So it is, I'm very pleased with Hardy supplements overall. Micronutrients has been studied in the research for a long time, especially when it comes to neurodevelopmental disorders. It becomes, when you're comparing whether it's a genetic issue or whether it's a nutritional deficiency, we found very early on that micronutrients plays a significant role in behavior issues and mood disorders. Where I really started looking into it is as soon as had to be probably 6 years ago, you started seeing a good amount of literature, and Hardy was already in the game with kind of testing out their formulation too. And I mean, they didn't just study an autism spectrum disorders, but they were studying neurodegenerative disorders, Parkinson's disease, schizophrenia. I mean, it's huge when you can help the quality of life for a schizophrenic patient with micronutrients. I recommend Hardy Daily Essential Nutrients to patients because it is supported by extensive research. They've studied a broad spectrum of neurological disorders and shown massive improvements that are clinically significant. It's kind of like a no-brainer. We want to give the patient their quality of life back as quickly as possible. So if you can add in a micronutrient supplement that helps you do that, I mean, it's a no-brainer. I recommend Hardy's Daily Essential Nutrients for patients with symptoms and neurological conditions that are in the spectrum of mental health disorders, or for patients who have focus and attention issues, depression, anxiety, mental clarity, brain fog, people that really struggle with irritability and sleep disturbances. And I do notice that patients that do have maybe more complex, higher up cognitive or mood instability issues, when you get them on Hardy Daily Essential Nutrients, they tend to, in combination with neurological rehabilitation, they tend to improve at a faster rate than without using them. So there's several reasons why certain patients might be a little bit more difficult. Some patients, after one treatment, they feel the effects. Sometimes it takes 3 treatment sessions for them to really feel better. So some of the patients that are a little bit harder and have a little bit more layers of complexity in terms of cognition and emotionality, they tend to speed up with their response to care when they take essential nutrients. So I do have many patients that use daily essential nutrients to transition from medication to the supplement, and this is where I truly believe that essential nutrients plays a essential role because we know in the research that a lot of these psychoactive medications or medications that affect your central nervous system, they're effective in short-term use, but they were never intended for long-term use. So I do see a lot of patients that by the time they find me, they have a lot of side effects on their medication they're on, and they're eager to find a way to help them get off of it. And the beauty of daily essential nutrients is that it gives their body those micronutrients and vitamins it needs to facilitate neuroplastic changes and neurotransmitter synthesis, so that whether it's the withdrawal or just supporting their brain health, it's a lot easier for them to kind of wean off and titrate their medications. The patients that do begin taking Hardy's Daily Essential Nutrients, they tend to see the positive effects right away. So even if it's just a sense of mental clarity, or a lot of times with concussion patients, they'll explain their symptoms that they just don't feel right or they're just completely out of it. So those symptoms tend to go away very, very much early on. And then about 3 to 4 weeks, they have significant improvements in their mental health. So whether it was depression or just a highly anxious patient. So it's fantastic. I personally tried the supplement, and I don't feel fast effects when it comes to taking supplements. And I would say within a few weeks, I could just tell them if I'm like cognitive demand and doing things all day long, and I really have to have a sharp mind. Hardy's Daily Essential Nutrients makes a significant difference for me, not like just getting like gassed out or just kind of just being super fatigued mentally. So I support the product, and the patients have said the same thing. I recommend Hardy's Daily Essential Nutrients because the product has excellent bioavailability. So that means when the patient takes a supplement, their body actually absorbs the nutrients from it and it can utilize it. Oftentimes supplements don't have great bioavailability for their bodies to actually use it. Any patient that has tried Hardy's Daily Essential Nutrients, they are completely satisfied, and they're very encouraged by the results. Micronutrients basically support so many of the neurochemical processes within the brain. So whether it's helping gene expression or mitochondrial production for energy, it's working on a cellular level to help neurons just be more productive and function easily. And I mean, something as simple as not having enough water or salt in your diet can mess up your orthostatic pressure when you go from sitting to standing. I mean, so those very little things, people forget how important it is. It's an electrical chemical potential that's always happening within the nervous system.